There are 3 questions every buyer asks before they choose a supplier, and most MedTech brands can't answer them clearly. If you can't answer them, your buyer definitely can't. And if your buyer can't answer them, they can't sell you internally.
We're going to give you all 3 questions, show you why most MedTech companies fail to answer them, and give you a simple framework to master all 3. So let's get into it.
Question 1. What problem do you solve? This is the most fundamental question a buyer has, and most MedTech companies can't answer it. They jump straight to what their product does without ever naming the problem it addresses. If your buyer can't clearly articulate the problem you solve after reading your website, your brochure, or your LinkedIn, your messaging has failed at the first hurdle. The problem is the entry point, and without it, nothing else lands.
And from a commercial perspective, if your sales team can't state the problem in one sentence, every conversation starts differently. There's no consistency, no shared language, and the buyer gets a different version depending on who they speak to, and that just erodes trust.
The fix. Write one sentence that describes the problem your buyer faces. Not a clinical description, the business problem, the workflow problem, the thing that's costing them time, money, or patient outcomes. Test it with someone outside the company. If they get it immediately, you're there. Question 2. How are you different from the other options I'm looking at? This is where the swap the logo problem lives. If your messaging could belong to any of your competitors, you haven't answered this question. Innovative solutions for better patient outcomes is not a differentiator. Every company says that. Your buyer is comparing you to 2 or 3 other options. They need to understand specifically what you do that others don't.
In sales, this is the question that decides whether you win on value or lose on price. If your buyer can't explain what makes you different, they default to comparing on the only thing they can measure, which is cost. And that's a race you just don't want to be in.
The fix. Identify the one thing that you do that your competitors genuinely can't claim. It might be your process, your specialization, your evidence, your clinical partnerships. Whatever it is, make it specific and make it visible. Question 3. What outcomes will I get? Not what your product does. What changes for me when I use it? This is the question most MedTech companies answer with features instead of outcomes. And we've covered this extensively in earlier videos. Your buyer doesn't care about your technical specs first. They care about what those specs mean for them. Fewer complications, faster recovery, more predictable procedures, reduced costs. That's what they're buying.
And this is the question that determines whether your buyer can champion you internally. When they go to their procurement committee, their board, or their clinical team, they need to be able to say, this is the outcome we'll get. If they can't say that clearly, the deal stalls every single time.
The fix. For every feature in your messaging, ask, so what? Keep asking until you reach the outcome the buyer actually cares about. Lead with that and support it with the features.
Okay, so here's a challenge. Ask 5 people in your company these 3 questions. What problem do we solve? How are we different? And what outcome do we deliver? If you get 5 different answers, you not only have a messaging problem, you also have an alignment problem. And no amount of marketing is going to fix that until you get everyone on the same page. This is something we do with every client we work with. Before we write a single word of messaging, we run this test, and the results are always eye-opening. The CEO may say one thing, the sales director says another, the product manager could say something totally different. That's the first thing we need to fix.
Once everyone can answer all 3 questions the same way, everything else gets easier. Your website, your brochure, your sales conversations, your LinkedIn. They all start saying the same thing, and your buyer finally gets a clear, consistent message no matter where they find you.
So there you go, 3 questions. What problem do you solve? How are you different? And what outcome do you deliver? If you can answer all 3 clearly and consistently, your messaging is in great shape. But if you can't, now you know exactly where to focus. And try the internal alignment test this week. Ask 5 people in your company and see what happens, and drop the results in the comments. We would love to know.
Next week, we're explaining the endless customer, strategy that can significantly compress your MedTech sales cycle. Subscribe so you don't miss it.